This is a special day. It's a hopeful day, and it's a good day for our residents, our staff, and our families. When COVID-19 came into the state of Oklahoma, we took it personally because it was a disease that was specifically designed to target and injure the population of people that we care for and that we've built our lives and our careers around. You know, I sometimes hear from younger women and men, you know, not in the skilled nursing profession, but they say that COVID is only dangerous for the elderly or the infirm, and therefore isn't a big deal. Frankly, hearing that makes me sick, because the life of an elderly resident in a facility like this is no more or less valuable than my life, your life, or anyone else's life. And that's why we fought so hard and continue to fight this terrible virus. It's why we ask the friends and the loved ones of our residents to limit their visitation, to distance themselves from our residents when all they want to do is come give them a hug. It's worth it because lives and saving lives are worth it.
In the first week since the vaccines arrived in the state of Oklahoma, we have given it to 21,000 healthcare workers and first responders. That number includes people from all 77 counties in the state of Oklahoma. Yesterday, the first shipments of the Moderna vaccines started arriving at county health departments, and we received about 10,000 doses yesterday, and we're on track for about 50,000 more doses who are on the way today, some more that we'll get tomorrow. Getting these vaccines at our county health departments will allow us to send strike teams out across the state. They'll be able to quickly and effectively administer it where it's needed the most. And as we've said, today isn't the end of our fight, but it's the beginning of the end.
We feel like we're going to be able to start into phase 2 of our distribution through certain parts of the state as early as next week. We anticipate receiving and distributing a total of 174,900 vaccine doses before the end of this year. This marks the beginning of a new trajectory in our fight against COVID-19. With more shipments of both Pfizer and Moderna vaccines slated to arrive in the coming weeks, we'll keep moving forward with our vaccination plan to help get it to those who need it most. This week, we began expanding our efforts outside of hospitals and will continue administering the vaccine to Oklahomans working and living in long-term care facilities. This year has been especially hard for those people, especially dealing with isolation, and we're hopeful that the effectiveness of this vaccine paired with other preventative measures will save lives and allow long-term care facilities to resume regular visitation for family and loved ones.
Mentioned all along that we want to make sure that we do this as efficiently and effectively as possible, which means that we're going to have concurrent operations. So just because we talk about moving into phase 2 does not mean that we're completely done with phase 1. We have overlap, and we need to do that for efficiency's sake. If we were to wait till we completely finish one group before we started another, then that just delays getting vaccines into Oklahomans. So our purpose here is to make sure that we can move forward as efficiently and effectively as possible and get moving on getting more vaccine into Oklahomans.